Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Can vitamin A help with vision, cancer and health? Break key takeaways. Vitamin A is a fat-soluble, essential nutrient needed for several normal bodily functions, including vision.Try to get vitamin A and carotenoids, which the body converts to vitamin A, from food sources instead of supplements unless your healthcare provider advises differently. Vitamin A can be toxic in doses that exceed the upper limit. Break vitamin A is a fat-soluble essential nutrient that supports healthy vision, skin, immunity, growth, and reproduction. People need to get it from foods rich in preformed vitamin A or carotenoids, which the body converts to vitamin A and number 148, along with some dietary fat to help with absorption. Break 1. Role in the body. Break vitamin A plays several essential roles in your body, including break supporting eyesight and eye health, supporting the immune system formation and maintenance of the heart, lungs, and other organs, cellular growth and differentiation, reproductive health. 2. Age-related macular degeneration. Break age-related macular degeneration, AMD, is a vision-threatening condition affecting the macula, the center of the retina at the back of the eye, which helps you see fine details. Break in a clinical trial, study participants who consumed more vitamin A, beta-carotene, or lutein and zeaxanthin from food had a lower likelihood of worsening AMD compared to those with lower dietary intake of these nutrients. Break since vitamin A toxicity from supplementation is possible, speak with a healthcare provider before taking supplements. Break a specific supplement has been developed to decrease the risk of worsening AMD. Earlier versions contained beta-carotene, but the AREDS2 supplement does not, as an increase in lung cancer was seen in smokers or former smokers who took the version that contained it. Break 3. Cancer. Break. A few systematic reviews and meta-analyses of studies suggested a lower risk of several different cancers with higher dietary amounts of the following. Break RetinolCarotenoidsFruits and vegetables combination of the above. Break results from some studies, however, didn't find a relationship between different forms of vitamin A and cancer risk. Break. There were also a few large and long-term studies that showed beta-carotene supplements with or less than /speak without retinyl palmitate, a preformed vitamin A, had harmful effects, and number 148, like lung cancer, and number 148, on specific groups of people. This includes people who currently or formerly smoked and people who had exposure to asbestos. Break. In other studies, these adverse effects were not seen, but these studies contained smaller groups of people who currently or formerly smoked. Based on these articles, the evidence regarding the relationship between vitamin A and cancer is mixed. Break. How much vitamin A do you need? Break. The Recommended Dietary Allowance, RDA, is the daily amount of vitamins or minerals needed for health. RDAs may vary based on age, sex, pregnancy, and breastfeeding status. Break. Upper limits, ULs, are the maximum amounts of a vitamin or mineral people should ingest daily. Amounts ingested above the daily UL may produce side effects or toxicity. Break. Daily vitamin A needs in micrograms, McGee, age ASL for animal-based foods and vitamin A supplements, birth to 6 months 407 and number 147 12 months 500601 and number 147 3 years 300604 and number 147 8 years 40909 and number 147 13 years 6001, 7014 and number 147 18 years 9002, 800 females 19 years and older, 7003,000 males 19 years and older, 9003,000 in pregnancy, age 14 to 18 years, 7502. 800 inches pregnancy age 19 and older 7703,000 when breastfeeding age 14 to 18 years 1,2002,800 when breastfeeding age 19 and older 1,3003,000 Where do you get vitamin A? Break Preformed Vitamin A and number 148, like retinol and number 148, is naturally available in various animal-based foods, such as break dairy, milk, products fish eggs. Break the provitamin A carotenoids are changed by your body into vitamin A. They are naturally available in plant-based foods, including break mangoes, papaya, squash, carrots, sweet potatoes, corn, not the white variety, red palm oil, buriti palm oil. Break nutrition guidelines typically place more importance on food sources of vitamin A than supplements. Although food sources are preferable, supplements may be needed for people with nutrient absorption problems due to age or certain medical conditions. Break what happens with vitamin A deficiency. Break vitamin A deficiency is rare in the United States. It is more common in developing countries, especially among pregnant and breastfeeding people and infants. Certain traditional diets may contain few foods with vitamin A. People in developing countries may also have difficulties accessing foods with vitamin A or provitamin A carotenoids. Break low vitamin A is also more likely in break cystic fibrosis less than /speak CF. Cystic fibrosis is a genetic condition affecting the lungs, pancreas, and other organs. Pancreatic problems may reduce the absorption of vitamin A into the bloodstream.Digestive system conditions. Certain digestive system conditions produce a higher risk of vitamin A deficiency. Examples include inflammatory bowel disease, IBD, and celiac disease. Symptoms. Breakers vitamin A deficiency is rare in the United States. Speak with a healthcare provider if you think you have a deficiency rather than self-medicating. Break short-term symptoms of a vitamin A deficiency may include break dry eyes, night blindness, trouble seeing in environments with low lighting. Break long-term or worsening vitamin A deficiency symptoms may include break abnormal lung development, high risk of anemia, irreversible, permanent, blindness, lung conditions, such as pneumonia, severe infections, especially from measles or infection-related diarrhea, death. What happens when you take too much vitamin A? Break vitamin A is a fat-soluble vitamin. The body stores excess amounts, primarily in the liver. These levels can accumulate over time, potentially increasing the possibility of toxicity. Vitamin A toxicity can result from exceeding the upper daily limit from animal-based foods or supplements, which is around 3,000 micrograms for people over age 18. Break vitamin A toxicity may produce the following effects. Break bone problems. Large amounts of vitamin A might cause bone pain and decrease bone mineral density, BMD, a measure of the strength and thickness of your bones. Low BMD increases your osteoporosis, weakened brittle bones, and bone fracture. Break risk. Brain swelling. High amounts of vitamin A might cause some brain swelling. Symptoms of brain swelling may include vision changes, seizures, and memory problems. Cancer. Vitamin A may increase the risk of lung cancer in people who currently or formerly smoked and people who have had asbestos exposure. Liver problems. There are reports of liver problems with vitamin A over the daily upper limit. If you have worsening liver function, symptoms may include upper right-sided stomach discomfort, dark urine, and yellowing of the eyes or skin. Negative effects on a fetus. If a pregnant person takes too much vitamin A and number 148, or even uses skin products with retinol and number 148, adverse effects can happen to the fetus. Break if you think you took too much vitamin A or suspect you are experiencing life-threatening side effects, seek him a less than /speak diet medical attention. Break. What are the side effects of vitamin A? Break side effects of vitamin A may include break appetite changes, dry skin, headaches, nausea, allergic reaction. Who should be cautious about taking vitamin A supplements? Break. People of all ages should avoid exceeding the upper daily limits of vitamin A from animal sources or supplements. A healthcare provider may advise against your taking supplemental vitamin A if any of the following applies to you. Break allergic reaction. Avoid vitamin A if you have a known allergy to it or its ingredients or parts. Adults over 65, some older adults may have a higher likelihood of medication side effects. Discuss your vitamin A use with your healthcare provider. Tobacco use, asbestos exposure, or lung cancer. Studies suggest beta-carotene with or without retinyl palmitate, a preformed vitamin A, had harmful effects. And number 148, like lung cancer and number 148, on people who currently or formerly used tobacco and people who had asbestos exposure. Talk with a healthcare provider before taking vitamin A supplements. Liver problems. Exceeding the daily upper limit, UL, of vitamin A is associated with reports of liver problems. If you already have liver problems, healthcare providers may want to closely monitor you and make any necessary medication adjustments. Osteoporosis. Large amounts of vitamin A may decrease bone mineral density. If you have osteoporosis, healthcare providers may want to closely monitor you and make any necessary medication adjustments. Does vitamin A interact with medications or other supplements? Break possible interactions include the following. Break medications or supplements that affect fat absorption. Medications or supplements that affect fat absorption will likely affect vitamin A's absorption. Examples include Xenical, Orlistat, for weight loss, and Questran, cholestyramine, for cholesterol. Retinoids are vitamin A-based medications. Combining vitamin A with retinoids may increase the likelihood of vitamin A toxicity and side effects. An example of a retinoid medication may include soriatane, acitretin, for certain skin conditions, such as psoriasis. Please review this supplement label with a healthcare provider to discuss potential interactions with foods, other supplements, and medications. Supplement use should be individualized and vetted by a healthcare professional, such as a registered dietitian, nutritionist, RD or RDN, pharmacist, or health_speak care provider. No supplement is intended to treat, cure, or prevent disease. In the United States, the Food and Drug Administration, FDA, does not regulate supplements the way it regulates prescription drugs. That means some supplement products may not contain what the label says. When choosing a supplement, look for independently tested products and consult a healthcare provider, registered dietitian, nutritionist, RD or RDN, or pharmacist. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak.